Nathaniel Brooks, no disclosures. I guess my question is probably more related to just the infection rate that you see with your tubular decompressions, and kind of, I know you gave good data on this, but your thoughts just kind of do you think it's a reproducible thing from service to service, or just something that you've seen in your practice over time?
I think from the decompression perspective, because the operative duration is short, they're staying outside of the infection exposure of the inpatient hospital setting. I think that makes the difference. I mean, I use Ansef as a standard antibiotic. It's given within a half hour before a skin incision. I don't do any post-op antibiotics. Typical length of stay for the decompressions is 45 minutes to an hour in the PACU, and then 1 to 2 hours in the same day unit before they go home. What strikes me is on the fusion side, I would expect at least a little bit, a small percentage of infections, because those operative durations are on average a little bit more than 4 hours. So I don't know if it's the lack of devitalization of so much muscular tissue that you're not really setting up an environment for an infection. Those patients also are not getting redosed with antibiotics. It's the half hour before and nothing else afterwards. A third did go home the same day, so that may make a difference, but several, 2/3 stayed in the hospital for anywhere from 1 to 2 days. I would expect them to have at least had a small percentage, but I didn't see it. I don't know if that's reproducible.
I think over time, payers and hospitals are looking at not just how many operations we're doing, but what the complications are over time, and that certainly is an issue in my hospital. So I think it's interesting just to look at those different techniques and see if they make a difference. So, yeah, thank you.